So we are going to move over to our mini grants panel one. And with that, I am excited to introduce my colleague, Shreya Koirala. Shreya is a program coordinator here at the Hepatitis B Foundation, where she really does work on all things Hep B United. Many of you likely have received an email from her prior to this summit regarding if you're a speaker or moderator, just giving you the details. But really would not, this program and coalition would not run without the great work of Shreya. So big thanks to her for that and for all of the work she's done to put together the summit. And now that I have thoroughly embarrassed her, I'm going to go make her moderate this session. So Shreya, take it away.
Thank you, Frank. Hi, everyone. Good afternoon. My name is Shreya Koirala. I'm the Public Health Program Coordinator for the Foundation. I hope you're enjoying today's sessions and recipes. Welcome to the last session for today. It's our mini grants panel. In this session, we will be hearing from three of Hep B United's mini grantees for the 2024-2025 cycle. Before I introduce the speakers to you, I will take some time to just talk a little bit about Hep B United mini grant program. Frank, if you could share the slides. Hep B United mini grants program is one of our most popular capacity building programs that we've been hosting from 2014. Next slide. Since 2014, we have distributed 85 awards, just under $750,000 to 20 states. We support our local partners to improve capacity, increase screening, education, vaccination, and linkage to care. For our every mini grant cycle, we award 6 to 8 awards for that you're ranging from $5,000 to $10,000. In recent years, we have opened the awardees to include PWID, African immigrants, and Asian American and Pacific Islander communities. Next slide, please. So the focus of our mini grant program is to increase awareness, screening, prevention, and education to reduce hepatitis B related health disparities. Also include the implementation of the new universal adult hepatitis B vaccination recommendations. The focus of the program is also to improve linkage to care and access to culturally and linguistically appropriate patient navigation services to prevent hepatitis B related liver disease and cancer, and also to strengthen surveillance or community level data collection to detect hepatitis B transmission and disease trends. Next slide, please. I know many of you present today have applied to our mini grant program in the past years, but just to recap, our application process is pretty simple. We typically release a forecast and an RFP a month or two before our application is open. Then our application for mini grant cycle is open. Our application is pretty simple. We have really tried hard in the past couple of years to have simple questions that's easy for all of you to answer, and we've really tried to be inclusive. Once we get the applications, we run an internal and an external review process. Internal review process includes Hepatitis B Foundation staff. So we look at each of our applications, see if it meets the criterias that we've highlighted in our RFP, and then we run an external review process, which the external reviewers are our partners who work in different areas that we again highlight in our RFPs, and we all get together, read the applications, and make the decision. And once we get through the review process, we decide who we award mini grants to, and we we let them know that they've received the award. And even after we award our mini grantees their grant, we do quarterly check-ins. We check in with them regularly to see if they've been facing any challenges or how their program is going. When we open our mini grant program, all of you will know, we'll make noise. We will highlight it on our newsletters. We will send out emails through our listserv. And yeah, that's it. And when we do open our mini grant program, we'll make sure all of you know. So this is it about our mini grant program. I just wanted to give a very brief introduction of what the program is. We can now move on to our presentations. Before I will like to introduce our today's speakers to you. First off, we have Affissath, Anjorim, and Ishraga Dousa from African Family Health Organization. Affissath is the Health Programs Manager for African Family Health Organization, or AFAHO. At AFAHO, she has effectively contributed to improving community health screenings as well as managing staffs and volunteers. Ishraga Dousa is the clinical specialist for African Family Health Organization. At AFAHO, she regularly leads community health screening events that serve nearly 200 people at a time and is especially passionate about addressing hepatitis B, given the high number of positive cases identified among underdeserved populations who are often unaware of their status and lack access to testing or care. Our next mini grantee is American Pacific Health Foundation, and representing American Pacific Health Foundation, we have William Chan today, who's an intern. William Chan supports community outreaches and hepatitis B screenings as part of Hep B United's mini grant project. Finally, we have Eunice Han. Eunice Han is a part of Korean Community Services of New York's liver health team, focusing on hepatitis B. They support program coordination, reporting, and data tracking for KCS's hepatitis B screening and education initiatives. They have also helped organize community health events to increase testing and awareness among underdeserved AAPI populations. So without further ado, I give it over to Affissath and Ishraga to talk about their mini grants project.
Thank you so much, Shreya. Can I share my screen? Oh, okay. Right.
I can let you share your screen if you'd prefer, but I do also have your slides if you would have me.
Either way was I will let you to that, like just I'll let you know. So again, thank you, Shreya. Hi everyone, my name is Affissath Anjorim, and I'm here today with my colleague Ishraga. We are both from the African Family Health Organization, and we'll be presenting today our hepatitis B program at AFAHO, and share also our work as a mini grantee of Hep B United, what we have done during this grant period. But before that, we would like to share a quick overview of our organization. Next slide, please. So AFAHO was founded in 2005 and was focusing only on HIV testing and prevention. So over the last 2 decades, AFAHO has been able to extend its services. So not only now we do provide health services, but also we provide social services and education services. You can see on this slide our founder, Mrs. Tikudakaba. Next slide, please. So we are located in West Philadelphia, and the people that we serve are African and Caribbean immigrant and refugee community from the greater Philadelphia. Next slide, please. Nearly 60% of our clients come from West Africa, including Mali, Guinea, Ivory Coast, Togo. We do have about 18% of our clients who are from Haiti, about 8% who are from Democratic Republic of Congo, and about 5% from Sudan. Next slide, please. So the main reason why our clients reach out for intake is to get access to medical care, but also a number of our clients reach out because they need help with have access to the prenatal care, which is the MCH, like maternal and child health. We do have other programs at AFAHO that are listed there, but the main one, as you can see on this graph, for medical care. They reach out to get access to medical care, but also for MCH. Next slide, please. So there are so many challenges that our population are facing, but we just want to kind of list this one because they are quite prevalent, like very current. So most of our clients, they are in lack of health insurance, right? So that is one of the big barriers that prevent them to get access to healthcare services or social or education services. But also, many of our clients are facing a language barrier because most of them, they come from non-English speaking country. We do have also some of our clients who are facing a lack of social support system, Some are dealing with stress and anxiety, especially during this time with the new political climate. And there are so more challenges as well that they are facing. Next slide, please. So I will pass it to Ishraga to speak a bit about our Hepatitis B program at AFAHO.
Yeah, thank you so much, Affissath. And hello, everyone. I'm so happy to be here. About our AFAHO program, Hepatitis B program, this program is more than 10 years. We support in our African and Caribbean community, among others. And in this program, we do care about 3 things: awareness, screening, and link it to care. Next slide, please. So what we do to do the awareness? The awareness, we train several cultural navigators and improve knowledge about hepatitis B among more than 1,000 of African and Caribbean immigrant and refugee community. Also, we screen, about the screening, we screen 100 of these communities for Hep B and link those need care to the medical care that is. So what is the problem? The problem that we found out, like 6 to 15% of this community that is in our event, they are seropositive for Hep B. And this is very big number compared to the nationwide, which is nationwide is like less than 1%. So when you come to this number, it's more than 20 times the nationwide. So it is a lot. It is a big rate number. Also, AFAHO has response to this unmet need for Hep B in our communities. So we do a lot of awareness, screenings, and education among these people. And I want to thank you. We really appreciate Hep B United for this help and giving us this grant for 2024 to 2025. So Hep B program strategies. So after all this, we have all these numbers. So what is our approach to tackle this? And these are the approach that we're using it. Number 1 strategy, we do education and awareness to our communities. So we develop culturally appropriate Hep B educational curriculum and translate this to many languages, that is French, Persian, Creole, and Arabic and Swahili. And we do this education by other also. There's many dialogues that is AFAHO speak, other dialogues other than this language. Also, we develop like 4 engaging educational videos in French, Haitian, Creole, and Soneki and Fulani. Also, it is short videos, like 5 minutes videos containing education and also encourage for screenings. Also, we conduct intense community outreach, targeting religious institution, business, and social organization, and other events. Also, we trained cultural health navigator to effectively deliver this curriculum for the community. This is like our educational video containing trainings and information about the virus affecting the liver, how the liver is important organ in the body, and if there is anything, how the health nutrition is helping that one. So next slide. Strategy number 2, partnership to support awareness. So we recruit 5 imams and pastors on hepatitis B to serve as ambassadors in their communities. And we did extensive training for these 5 people. And this training includes general knowledge and education using CDC materials, and also discussion and role play for more than 2 sessions for these pastors and imams to be ambassadors for their community. Next slide. So strategy number 3 is screenings and vaccination and link it to care. And this is very important, especially screening, because most of them, they don't know their status. So we conduct like 100 African and Caribbean individuals to Hep B screening and 50 people to the vaccination via activities with our partner at Hep B Foundation and BH Philadelphia Health. We also host screening events in the community and AFAHO office. Religious ambassadors assist with the recruitment. So because of these large numbers, we need also people to assist us. So these ambassadors assist us in the recruitment. Connect those who need primary care, those who are positive, we connected them to the care. We help them with the interpretation and accompaniment to tell them, to help them navigate the system. So I will give it to Affissath to continue.
Well, thank you, Ishraga. So strategies 1, 2, and 3 have been implemented during this grant period. And what are the outcomes? So for the strategy 1, which is related to education and awareness, we have been able to share the educational videos with more than 1,500 individuals in the community. We were able to recruit 51 participants into our programs, and they were aged from 14 to 65 years old. Both female and male were represented in our group setting, and most of them were from West Africa, but we do have a certain number as well coming from DRC, that is Democratic Republic of Congo, and some also are from Caribbean. Next slide, please. Still, when it comes to this strategy, the workshop, actually, we conducted a pre-test, a survey with the participant. Then we let them watch the video, the educational video, and afterwards, we conducted a post-test survey with them. And as you can see here, we have noticed that the post-test score is higher than the pre-test score, which means that there has been an increase in knowledge and awareness of Hep B among the workshop participants. Next slide, please. When it comes to the second strategy, like developing partnership to support awareness, right? Especially with the faith leaders in the community. So we have been able to recruit 5 community faith leaders in total, including imams and pastors. The ages range from 39 to 68. They are all males, and they serve West Africa community, Democratic Republic Congo community, and also Sudan and North Africa community. Next slide, please. So our community faith leaders, they were included in the training as well. As Ishraga said earlier, we conducted more than 2 sessions of training with them. The first session was mostly focused on the awareness of Hep B. What is Hep B? How is it transmitted? How is it spread? What are some resources available in the community? Now, the second training was mostly focused on the role plays, like when this community member comes to you and they ask you this question, or you hear this in the community, how can you actually, as an ambassador, a Hep B ambassador in your community, how can you answer this question? So we conducted this kind of training, and we assessed them as well in terms of how was their knowledge of and awareness of Hep B, but also how did they feel if there was an increase of feeling of being well equipped, right, to serve as Hep B ambassador in the community. And you have noticed that there have been the post-test score was higher, which is 80% compared to the pre-test, which means that there have been an increase in knowledge and awareness, and also they felt really equipped to serve as Hep B ambassadors. And as a matter of fact, we have been able, some of them were able to recruit some folks to get screened at our health events for screening. Next slide, please. So when it comes to the third strategy, right, Ishraga mentioned earlier that we conduct screenings vaccinations, and linkage to care. So we have been able, during this grant period, we were able to screen up to 102 individuals in our community. Their age were from 18 to 78 years old. Both male and female were represented. We had about 59% of those who were screened were from West Africa. About 27% were from Caribbean, about 10% from Sudan, and about 5% from Central Africa. Next slide, please. Continuing with the screenings and vaccine and linkage to care. When it comes to the vaccination, we were able to get 61 individuals vaccinated against hepatitis B. The age range from 18 to 62 years old, and they were both male and female represented. About 64% of those who were vaccinated were from West Africa. About 23% were from Caribbean, and about 14% were from Sudan and North Africa. Next slide. So when it comes to the linkage to care, again, this is a part of the third strategy. We're among the 102 individuals that we screened during this grant period. We found out that 20, which is about 19.6% individuals needed follow-up care. So those one with our partnership, via our partnership with the Hepatitis B Foundation, we have been able to successfully link these 20 people to care. Next slide, please. So how have we been able to achieve all this, especially when it comes to the screenings, vaccines, and linkage to care? So we at AFAHO, we host health screening events every year, right? So over the grant period course, we were able to host 3 separate health screening events. One in April one happened in April 2025, the second one May 2025, and the third one in June 2025. Next slide, please. So those were the outcomes that we wanted to share with these strategies that we implemented during this grant period. So what is next? We just want to continue to do this work in the community, because as we have seen, out of 102 people who were screened, right, 20 people were not aware of their status, and they were actually positive, and they needed to be connected to care. So this is something that there is still an unmet need in the community. So we need to secure more funding to reach more African and Caribbean immigrants and refugees in the community. So the second thing also that we want to point out here is that with the new political climate, there is more attacks on immigrants, right? And this increases even the fear, the anxiety, the stress for our community members to even access to healthcare services, which make this kind of programs at AFAHO truly important. So on that note, I want to thank you all. Thank you. I will pass over again to Shreya. Thank you.
Thank you, Affissath. Thank you, Ishraga. You guys do such incredible work. For our audience members, if you have any questions for any of our speakers today, please feel free to drop that in the chat. Now, moving forward, I am handing it over to William Jan from American Pacific Health Foundation to talk about their mini grant project.
Hello, everyone. I'm William. I'm one of the program interns with the American Pacific Health Foundation. Today we'll just talk to you all about our HBU mini grant project. Thank you for having us and for giving us the opportunity to carry out this project. Next slide, please. So about the American Pacific Health Foundation, APHF, we're an organization with a mission to advance health and wellness for vulnerable groups in the San Diego area by providing health education and free community health screenings for hepatitis B and C, diabetes, hypotension, cholesterol disorders, vision health through community outreaches. And for our community outreaches, we tend to host them bi-monthly or monthly in collaboration with organizations in the community, such as community-rooted organizations, as well as academic organizations like UC San Diego, and also various prominent religious centers. Next slide, please. And so this is what our outreach typically looks like at one of our events. So a participant will start with registration, where we just get some basic info about them, how to reach out to them, for example, an email of how to reach out to them based on their results. And at that point, they also do a pre-assessment survey just to get their knowledge level before going through our screening. And moving on to the next step, we also have our on-site screening services, and depending on the space that are allocated to us at each event, we offer, again, vision, hypotension, hepatitis B and C, diabetes, and cholesterols, and participants are able to go through each of the station and get the screening that they need. And then after getting all the screenings, they move on to the education and consultation station, where our medical preceptors, who are licensed healthcare professionals, essentially give them a consultation based on the screening results. Some of the screening results, such as vision, cholesterols, they will get them on the day of the event. So our preceptors are able to kind of talk through the results with the participants.
5530.
And then after consultation with our preceptors, participant also take a post-assessment survey. And so we use these assessments to kind of measure the knowledge change right at our event. Next slide, please. And then with the HBU United Mini Grant, we were able to carry out our project viral hepatitis B screening, education, linkage to care across San Diego County. And the Hep B priorities that our project focused on was essentially increasing awareness, screening, prevention, and education to reduce hepatitis B related health disparities, improving linkage to care and access to culturally and linguistically appropriate patient navigation services, and lastly, to strengthen surveillance to detect hepatitis B transmission and disease trends. And throughout our project, we were basically guided by this philosophy of starting from outreach and then taking participants through screening, education, and then linking them to care. So during our grant period, we were able to host 18 outreaches in total. 15 of them were clinical outreach, and then 3 were just purely educational. And of those outreaches, we were able to screen 71 individuals and also educated 100 plus individuals on hepatitis B and C. And of those that we screened, here are some of the demographics. 15% were ages 20 to 39, 45% were ages 40 to 64, 39% were ages 65 or above, and 38% identify as male, 62% identify as female, and the ethnicity that we were able to reach also include Asian, specifically Chinese and Vietnamese, Native Hawaiian or Pacific Islander, Hispanic or Latino, African American or Black, as well as white individuals. Next slide, please. So since the getting of this mini grant, we have established a linkage to care team within our organization. So at the outreach, we collect the blood samples needed for hepatitis B and C screening, and then we send them off to a lab, and about a week or 2 later we get the results. And then within our linkage to care team, we look at those results and essentially put different participants into different profiles. So, for example, profile one, based on hepatitis B antigen results, we can see whether they have active infection or not. Based on Hep B core antibody, we're able to see if they have been exposed or have been infected. And then lastly, hepatitis B surface antibody to see if they have any immunities. So, for example, participants that are in profile one does not have an infection but do not have an immunity, so they would need vaccination. And then participants in profile 3, for example, they do have an active infection and no immunity, so that they do need immediate treatment. So we've also worked with our medical preceptors with APHF to develop different reports that we can send to participants. And each report, it also includes, for example, recommendation for their primary care provider, so that the primary care provider are able to conduct further testing or give them give the participants the necessary treatment. And that is all part of our linkage to care team effort. And then based on the screenings that we've done, we were able to we found that 27% of participants lacked immunization to hepatitis B, and then these participants required linkage to care. And then 13% do not have health insurance nor a primary care provider, and then 51% have an annual household income less than $25,000. And so we were able to kind of provide these screenings for more underserved communities. And these again, these are the findings that we found through our screening. Next. And some of the ongoing work that we have, even though after the grant period, we're happy to report that we're currently in the process of signing an MOA between our organization with the Family Health Centers of San Diego. Family Health Centers of San Diego is one of the largest federally qualified health centers in the nation. And they have more than 90 sites across the San Diego County, and also provide care to more than 227,000 patients each year, and many of whom are low income and underinsured. And essentially what we hope to be able to provide with our participant through this partnership is linking them to the necessary resources. And we want to take it essentially one step further before we are able to get them the hepatitis B screening results, for example. We hope to also connect participants who lack insurance or primary care provider to the Family Health Centers of San Diego, so that they're able to get the care that they need. And then depending on the results based on the hepatitis B screening, we're able to also refer them to, again, the Family Health Centers of San Diego to get the follow-up care. And in realms of education, we have also since developed the healthtransmission.org, which is essentially an online platform that we've created that utilizes the train-to-trainer model, which is an approach essentially that we've taken for community health education. So individuals are educated by a trainer knowledgeable in a topic. Some of the topics that we have right now on our website includes hepatitis B, tuberculosis, diabetes, and among others. And so once a learner completes a training, they're able to become certified and become a trainer. And our goal is for the information to spread exponentially from person to person, fighting disease transmission with information transmission. And this is actually a outcome of a previous mini grant that we've received from hepatitis B, but now we also have even larger team dedicated to this project. Some of the challenges we encountered during our grant period was that we weren't able to reach all of the populations that we had intended to reach when we had submitted the application. So, for example, populations of people who use drugs as well as African immigrants. And another challenge that we faced during the grant period was also low participant turnout, but we have consistently partnered with different organizations to try to expand our reach. So for example, in September 13th, we partnered with Black Tech Link, which is a nonprofit organization that was created to help close the workforce gap of Black populations that resulted from the COVID-19 population. And then We also have another clinical outreach upcoming with the Bridge of Hope in San Diego. And the Bridge of Hope is another organization that aims to serve families in the midst of transition, whether that be overcoming homelessness, feeling, defeating a drug addiction, things like that. So we have definitely, despite these challenges, tried to expand our reach to different organizations and communities. And that is all for for what we did for the HBU mini grant. And yeah, thank you all for listening. And here's our website and email. If you have any questions, please let us know.
Thank you so much, William, for this wonderful presentation. Moving on, we have Eunice Han from Korean Community Services, and over to you, Eunice.
Hello, everyone. My name is Eunice Han, and I'm a project coordinator with the Hep B team at KCS, and I will share what KCS has done as a mini grantee for the FY25 grant period. Next slide, please. Okay, so some background information about KCS. KCS is a nonprofit that was founded over 50 years ago in 1973. KCS's original mission focused on serving primarily Korean immigrant communities, but we have expanded since to serve a broader Asian community. We want to help underrepresented populations to overcome health, economic, and linguistic barriers to become thriving, independent members of the community. KCS offers a wide range of services in areas such as aging, like we have an adult daycare, and we also have a meal service for our elderly clients. We also do education, immigration, and legal issues, workforce development, mental health, research studies, and we also try to help public health. My department, the Public Health and Research Center, PHRC, addresses some health needs and challenges faced by immigrant communities, and we began Hep B initiatives starting in 2007 to reduce health disparities among Asian immigrant populations for hepatitis, with the help from the NYU Center for the Study of Asian American Health. And we have continued to our hepatitis initiatives since. Next slide, please. So some services that we help, what PHRC helps with, are enrolling for Medicaid and Medicare and other health insurances like emergency Medicaid. We also outreach to members of our community on health education and prevention. And we try to conduct routine screenings for things such as breast cancer screening, and we're even going to start doing some lung cancer screenings as well. In New York City, we primarily serve areas in the boroughs of Queens and Manhattan, and we also service areas in New Jersey, such as Fort Lee and Palisades Park, and they have a high population of Korean people there. And this year we branched out and we held a screening event in Brooklyn, and we're hoping to continue expanding more in the future. Okay. So our Hep B team's main objective this year was to increase access to educational and medical resources for the Asian American Pacific Islander populations, primarily we serve Korean, Chinese, and Punjabi communities. We hold screening events, and we also help with patient navigation by linking patients who screen positive for Hep B to care if they need. And we also organize health events such as our annual Liver Health Forum. Next slide, please. Our main deliverables for the current grant period were to educate our community members and share Just B stories. We disseminated hepatitis B vaccine resources containing linguistically and culturally tailored information in 4 languages: Chinese, Korean, Punjabi, and Hindi-speaking communities. And we were trying to dispel misconceptions that people have about hepatitis B within our communities and try to provide some vaccination options and send people to free clinics if they need. We screened 90 members, Asian American Pacific Islander members, for Hep B from hard to reach and high risk populations in the New York City metropolitan area, and also in Bergen County, New Jersey, from a total of 6 screening events. We connected 12 uninsured patients hepatitis B patients to free or low-cost Hep B medications, and also engage with them to develop better practices in the usage of these medicines and help them increase their understanding of the side effects of the medications. And we also had peer-to-peer education for 3 community faith organization leaders from Chinese, Hindi, and Punjabi, and Korean communities to equip them with knowledge, and also share some outreach strategies to serve as community advocates so that they can help deliver culturally and linguistically sensitive information on HPV and other related liver diseases. Next slide, please. Some successes that we had this year were we continue to raise community awareness and education, community screening, link patients to care, and also try to form new partnerships. We continued our collaboration from last year with United Sikhs to screen Punjabi and Sikh within the South Asian communities. And we're also trying to form more partnerships, like branch outside of Queens, like we had a screening event in Brooklyn, so we're trying to do more of that. One major challenge that we faced this year was community hesitancy and among undocumented populations. Current and upcoming immigration policies, as we all know, have deepened community fears, and it's making it very hard for undocumented individuals to feel safe and to access services. Something that we've encountered a lot where the undocumented populations that we serve, they feared that their documentation status would be made public if they opted to get screened. So we had a lot of people who declined getting screened. This challenge showed us that it's very critical to address privacy and safety concerns directly when working with these undocumented populations during this time. Next slide, please. So our plans for the future, we want to continue working with the New York City Department of Health's goal to eliminate viral hepatitis by 2030. We want to continue to secure more funding and support from New York City council members through advocacy efforts. And we want to expand to increase screening among our current targeted populations and also just expand our geographic reach. Next slide. Okay, so thank you all for your time, and please reach out to us if you have any questions. We have an Instagram, Twitter, Facebook, and LinkedIn account. And we also can go to our KCS website. Thank you.
Thank you, Eunice, and thank you all for your wonderful presentations and letting us know how awesome you are and the kind of work you do in your communities.